Hello and welcome to NCTV episode 113, which is all about Piriformis syndrome. If you're unfamiliar with this, then it's also known as that thing that makes you feel like a wasp stung you in the buttock. Not fun, but luckily help is at hand. So what is Piriformis syndrome? Well, it's a condition where the piriformis muscle, which sits deep in your backside, gets irritated or tight and decides to press on your sciatic nerve. The result? Pain, tingling or numbness down the back of your leg, which is basically sciatica, but more like sciatica's mischievous little cousin, if you will, aka Dan Coysh in my case. Sorry Dan if you're watching. In terms of diagnosis, it's usually diagnosed through physical examination, ruling out lower back causes and sometimes, but less commonly, through MRI or nerve conduction studies. How does it happen? It can creep up on you for a variety of reasons, such as overuse from running, cycling or long periods of sitting, so that is both marathon runners and Netflix marathoners alike who might be at risk. It can also occur due to muscle imbalances, weak glutes or postural issues. A good old-fashioned injury or strain may be the cause. Maybe even anatomical quirks. In some people, the sciatic nerve actually runs through the piriformis muscle, making it even more likely to get squashed. Here's what to look out for in terms of signs and symptoms. Firstly, a deep aching pain in the buttock, and I don't mean that certain someone most people have in their lives. Pain that travels down the back of the thigh, sometimes even to the foot. Worsening pain when sitting, climbing stairs or after prolonged activity. Some people may experience a bit of numbness or weakness in the leg too. Also, it's been known to produce a warm or hot sensation in the buttock, so if it feels like there's a radiator in your rear, it might actually be piriformis acting up. It's a little bit sneaky because it mimics sciatica, but the key difference is that the source of the problem is in the glute and not the lower back. And now on to the good stuff. How do you fix it? Well, as an osteopath, it would be amiss of me not to mention that osteopathy can of course help by assessing your movement, testing what's causing the irritation, and use hands-on techniques to relieve tension, improve mobility and rebalance any compensations. Osteopaths can also look at your gait, posture and overall biomechanics to prevent it from coming back. Other therapies that can help are massage therapy. Deep tissue work can help to release that tight piriformis. Physiotherapy can help with strengthening weak muscles and correcting imbalances. And also acupuncture or dry needling can be used as a great way to help calm down nerve irritation. So if you're struggling with piriformis pain, here's a few self-help tips you can also try at home. Firstly, stretch it out. The figure 4 stretch, lying on your back with your ankle over the opposite knee and pulling your leg towards you is a classic. Foam rolling, gently roll over the glutes, which can help to relieve the tension. Strengthening weak muscles, focus on core and glute exercises to support the area. And heat or ice. Heat can relax the muscle while ice can calm the inflammation, and just see which one works best for you. Avoid prolonged sitting, take breaks, walk around and don't sit on hard surfaces for too long. As for the diagnosis, well thankfully with the right approach, piriformis syndrome is usually very treatable. Most people will improve in a few weeks with a combination of manual therapy, stretching and strengthening. But if left unchecked, it can become a recurring issue, so it's best not to grit your teeth and sit through the pain. And that's it for this week's bite-sized bit to help your health flourish. I'll see you again next time. Bye for now.